Good morning and welcome to our weekly COVID-19 update briefing. We're doing it one day earlier this week due to the impending bad weather we anticipate tomorrow. Unfortunately, we continue to have a number of positive cases in the parish. As of this morning, in the parish we've had 2,619 positive tests. That's an increase of 129 in 6 days. Also, we've had a slight increase in deaths. We had 7 more deaths, which brings the total to 92. As a matter of interest, statewide, we have 4,656 deaths. So, ladies and gentlemen, it remains a very, very serious problem. Governor Edwards previously indicated that we would remain in phase 2 for 3 more weeks, which would terminate this coming Friday on the 28th. But during this time, even though we had some improvements in our test results, we still haven't reached the criteria that we need, the federal criteria that we need to go from phase 1 to phase 2 to phase 3. There is some good news in the number of hospital admissions are down, and professional equipment is more available, but perhaps more importantly, we have more staff available to work those who have to go to hospitals. I think it's likely that the governor may announce later this week that we will remain in phase 2 probably for 2 more weeks, but that's just my suspicion. I don't have any facts on that, but the governor will be have a press conference this afternoon, and we may get some indications, but I suspect even though we're improving and getting below the goal of 10%, we still have far too many positive cases and deaths. So I just think we're probably going to be continuing in this phase 2 for a while. But again, more on that to come. The Center for Disease Control and the governor are urging that everybody get a flu shot this season. And some experts say the sooner the better. The flu season generally starts somewhere in September of October and runs through about February of March. So it is highly recommended that because of the obvious compounding the problems having COVID-19 symptoms and flu symptoms and cases, it's just prudent that we all get a flu shot this year. By the 7th of September, it's estimated that we'll have about 40 of our schools and colleges open in some form or some degree, and that's going to be closely monitored to see what impact it has, either positive or negative, on the number of test results that we're experiencing. We'll just see. The critical issues that remain to keep us from moving to phase 3 are the lack of wearing the mask, many bars and other businesses not complying with the directives, lack of social distancing, non-compliance with crowd sizes, and occupancy limits. That hasn't changed, ladies and gentlemen. Businesses, as we pointed out in the past, have been designated as responsible for enforcing the mask wearing and occupancy and crowd sizes, and inspections continue to be made by the Louisiana offices of the State Fire Marshal and the Louisiana Office of Alcohol and Tobacco Control. The general criteria remains that your business might receive a couple of courtesy visits pointing out where you may not be in compliance, but if it happens a third time, the business will normally be cited. However, if on the initial visit the violations are flagrant or egregious, they will take action immediately, and a business could perhaps lose its permit to operate. There's also some concern about the fact that some 40% of people are assumed or believed to be asymptomatic. And it's just important that while that is a fact, they still can bear the virus, and they can infect their family, their friends, their associates, and just don't assume because you don't feel the symptom that you can't do bodily harm to others. So what can we do to improve? And again, that remains unchanged. We simply have to comply with the prevention and mitigation procedures. Wearing the mask, washing the hands up to 20 seconds is recommended. Cough into the bend of your elbow. Do not touch your face. Disinfect surfaces like handrails, doorknobs, things that are touched frequently. Social distancing. Stay home if you're sick and follow the advice of your medical provider. As a matter of interest, with the national election coming up on November the 3rd, there is some difference of opinion at the state level in absentee voting. Some members want to increase the number of days one can vote early by absentee voting, and increase the voting hours by an hour and a half, and also to include people who have had tested positive for COVID to be able to vote absentee. The governor has taken exception to some of these things and has indicated he would veto it. So it appears that this may very well end up in court, but it will affect the voting come November 3rd. Hopefully it'll be resolved by then. As of this morning, I've learned that the governor has canceled all the drive-through testing facilities for the rest of this week because of the weather. I just strongly urge that all of us follow these 8 mitigation and prevention steps if we want to, in fact, do what we can to move to phase 3 and reduce the number of illnesses and deaths. Again, let's be part of the solution, not part of the problem. Our next briefing will be Thursday, September 3rd. Thank you, and good day.